Meanwhile, advocates for people with physical and developmental disabilities say those people need to be prioritized because they are more vulnerable to infection than the general population. Krista Carr is the Executive Vice President of Inclusion Canada. It's a national federation that works on behalf of disabled Canadians and their families, and she joins us today from Toronto. Krista, thank you so much for making time for us.
Thanks for having me, Natasha.
So I know that your organization has a national scope, but as you just heard from my colleague Chris, Ontario has updated who's next in line to get the province's vaccine. So we've got adults over the age of 80, people with who require chronic support in their homes because of healthcare related issues. Does this address the need for people with disabilities?
Well, it's really hard to know because it's not clear. And it's like most of the information we're getting right across the country. It's very unclear. So people who have chronic home care needs, what exactly does that mean? How will that be determined? It may include some people with disabilities. It may not, particularly if they're going to use the number of home care hours that someone receives. Well, during this pandemic, a lot of people with disabilities who live in their homes have had to have less hours. They can't have people coming in and out of their homes. And so those hours have been taken over by a family member or close relatives or those to other people that live in their homes. A lot of that home care need has been taken over by them to try to keep people safe. And so will they be still included? Or what happens about people with disabilities who, for example, receive care in their home, but it's not categorized by home care.
So, Krista, let me ask you this. What are you asking of the provincial and federal governments?
Well, I think we're asking for them to follow the science. I mean, one of the biggest issues that we have in Canada is that we have not been collecting data around who is getting COVID and who is dying from COVID. So we have to rely on the data we're seeing in other countries. And so, for example, the Office for National Statistics in the United Kingdom just published a brand new study saying that 6 out of the 10 people who have died from COVID in the UK have a disability. An earlier study than that, just a bit earlier than that, said that people with intellectual or developmental disabilities, which is the population that I serve, particularly people with Down syndrome, etc., were 4 times more likely to be hospitalized with COVID and 10 times more likely to die. So what we're saying is that we want the governments right across the country, provincial and federal, to be looking at this and saying, if we're not going to collect the data here in Canada, we have to at least go by what good data is out there and prioritize people who are at a higher risk of dying from this virus or becoming very, very ill.
Krista, so let me ask you, for this past year, as this entire planet has been dealing with this, and we've heard repeatedly from our own elected officials, they've said time and time again, frontline workers, senior citizens, people who are economically marginalized. We know that poor people are much more likely to get sick and have less access to healthcare. But to be honest, the issue of disabilities is seldom brought up. Why do you think that is?
Well, if you want my honest opinion, the reason why it is because people with disabilities are never prioritized. They're 22% of the Canadian population, and they seem to be at the bottom of the list for everything. They're at the back of the list in the triage protocols. They're the last in line for the ventilator. The only thing that they're ever prioritized for, or it seems that recently our conversation around medical assistance in dying, if Bill C-7 passes, they'll get prioritized for that. But that's it. That it's death only. And so it's people with disabilities are often left out of the conversation, and it's been an ongoing challenge throughout this pandemic.
So then again, I guess I'm repeating the question. Why do you think that is? Is it because they don't represent a voting bloc, that they don't have great advocates for and it's such a broad range between physical disabilities and developmental disabilities. Why? Because if everyone's saying we want to support the most vulnerable, it goes without saying that people who have some form of a disability are vulnerable by default. So why don't our politicians or the doctors press on this issue?
To be honest, Natasha, it's a question that the disability community has been asking for a very long time. And I don't know the exact reason What I do know is that very often people with disabilities and their families are struggling to survive day to day. And so they're likely not going to be the ones you find on the steps of legislatures with the, staging the protests. They are just trying very hard in very difficult circumstances to get by day to day. And so, if I could use this opportunity for anything, it would be to say, tell people with disabilities that they matter, show them that they matter, and prioritize them because they are a legitimate priority group and they should be in that queue as a priority group for the vaccine.
Krista, it's been really enlightening speaking with you. Thank you so much for your time.
Thank you, Natasha.
Krista Carr is the Executive Vice President of Inclusion Canada.